This is Annika Nath. She's 5 years old. Annika is doing something her mother Monica wasn't sure she would ever be able to do. She's walking. Annika has cerebral palsy, or CP, as a result of a brain injury at birth.
Earlier I used to be very, very sad. The first couple of years of her life. She is what she is and I just have to get her better. That's how I feel now.
For the first 3 years of Annika's life, her parents searched for therapies that would help Annika develop.
We tried a lot of therapies with her initially, and I would do a lot at home with her, but nothing was satisfactory.
By age 3, Annika's development was severely arrested.
She could sit, but she would fall when she would try to pick something up because she had very poor balance.
Then she discovered the TheraSuit method of intensive physical therapy.
When I came here, now she is in a walker in school all the time. And I think that's huge for me.
Annika, now 5, has been coming to the TheraSuit Center twice a year for the last 2 years. Monica is seeing the results, and so are others.
When the school therapists themselves are really happy to see that progress, they never imagined it. When I see the therapist saying that, I feel so good. that she's going beyond what they expected.
The TheraSuit method is the new standard of intensive physical therapy for children and adults with cerebral palsy, spinal cord injury, or neuromotor disorders.
Take a step. 1.
Our goal was bring new kind of therapy, new kind of like a consciousness.
Richard and Isabella Koscielny are the founders of the TheraSuit method. Their model clinic, the TheraSuit Center, is located in Keego Harbor, Michigan. It offers a new type of treatment based on the very latest research on exercise physiology.
The standard therapy is based on the philosophy from the 60s and 70s when the medical and research from the exercise physiology was not developed. This kind of therapy is much more advanced, is supported by the research, is supported by the physicians.
Richard Topolewski's son Zachary has cerebral palsy.
We start contrasting them to other kids or what other kids are capable of, it gets really tough.
Seeing his son's lack of development was difficult.
The school system allotted us, I think, like 20 minutes 2 or 3 times a week. And again, that was, in terms of one-on-one individual time. But the school system therapy really wasn't moving them along as we would like.
Can I have a kiss?
Richard and his wife Debbie decided to try TheraSuit therapy. This video was recorded prior to Zachary beginning the TheraSuit therapy. He has difficulty sitting and is unable to hold himself up on all fours, let alone stand or walk.
Zach is very delayed. He suffers from a lot of spasticity, which totally inhibits his function.
When we first came in therapy, he wasn't able to roll. We got the rolling, get him to standing, being stable, then taking the step, and then building upon step after step.
Less than 2 years later, Zach is able to take steps with the help of a walker.
This is another phenomenal thing that with persistence, that with this incredible dedication, even the most involved kids do succeed.
Patients using the TheraSuit method train 3 hours a day, 5 days a week, for up to 4 weeks. The TheraSuit is so effective that it's now being used in some of the finest healthcare facilities in the world, including Easter Seals, United Cerebral Palsy clinics, and numerous children's hospitals. Since 2002, Richard and Isabella have trained over 2,000 therapists in 120 clinics worldwide. Kevin O'Neill is manager of the Outpatient Therapy Center at Crittenton Hospital in Auburn Hills, Michigan. He has specialized in the treatment of CP and spinal cord injury for over 12 years.
Even within the hospital system, there's a higher recognition for this intensive training.
Kevin and many on his staff have been trained by the Koscielnys and have incorporated much of the philosophy and techniques of the intensive therapy model into their clinic.
This is going to do more and have a longer outstanding benefit as opposed to the traditional method. We're getting kids in here and we're getting them better faster.
For Richard and Isabella, who both hold master's degrees in physical therapy, it is less of a business and more of a passion. Their 16-year-old daughter, Kaya, was born with cerebral palsy.
She's this incredible inspiration to so many other kids, and she brings so much joy. From the other angle, when I sometimes look at her, how much more work she has to do to keep up with just the daily life skills, it sometimes really gets to me.
Like other parents, the Koscielny's tried numerous treatment programs. None gave Kaya the results for which they had hoped, except one, a therapy center located in Poland. Here they learned of the intensive style of physical therapy as well as a rehabilitation suit. With its help, Kaya began walking. Richard and Isabella returned to the States and were the first to introduce this type of program in 1994. In 2001, the Koscielny's designed and patented their version of the rehabilitation suit called the Thera suit. It is FDA registered and is utilized in the U.S. and around the world. After establishing their program in a local hospital, Richard and Isabella started their own state-of-the-art intensive TheraSuit center in 2003. TheraSuit is also being used here to help those with developmental delays, traumatic brain injury, and post-stroke victims, and those with ataxia, athetosis, and hypotonia.
Did it, strong girl. Again.
Julie Roche's granddaughter has CP. Julie is helping to take care of her.
At about 5-6 months, when she wasn't developing normally, then we realized that she was going to have some lifelong problems.
As Sarah matured, things got worse.
She could not sit up, she could not crawl, she could not walk, she couldn't feed herself.
Sarah started occupational, speech, and physical therapy through a Head Start program, but the results were disappointing.
I wouldn't say useless, but you're not going to get as much improvement with just 1 hour per week of any of those things.
After just 2.5 weeks of intensive therapy, Sarah began to improve.
Sarah can sit up by herself for about a minute unassisted. She can roll from back to front, which she was not able to do. She's realizing now that she can do more things. I have visited a lot of other therapy places prior to coming here, and this was, as soon as we walked in the door, very welcoming, very child-friendly, very child-oriented.
If they're coming from 50 miles away or from out of state or out of the country, that it is a hard trip for them to travel, and we try to make it as comfortable as possible. We have also nice little rooms that they can go into, be quiet and get away from. Just makes their trip a lot more pleasant.
There's basically no comparison.
Sherry Hudson is a registered physical therapist at Miami's Children's Hospital.
After 18 years of doing this is the only way I see that we can make significant progress.
5 years ago, she was introduced to the Koscielny's and the TheraSuit method. She's been impressed ever since.
I've looked at so many different avenues of therapy, especially for the CP child, and this is the only thing that has worked.
The TheraSuit method consists of 5 steps. Step 1, warm up and stretch. The patient's muscles and tendons are warmed and stretched. Hot packs and massage are used to bring blood to the surface muscle tissue. Step 2 targets strength training and range of motion. This step utilizes the Universal Exercise Unit, also known as the cage.
We do both things at the same time, which saves us tremendous amount of time.
I could take a child with the old traditional sense, have them 3-4 times a week at 45 minutes, spend probably 6 months to get not even close to the same results of what I could do with a child just 2 to 3 times a week for an hour in the Universal Exercise Unit.
If you just go once a week for 1 hour, throughout the entire year for physical therapy, you will have maximum 45 hours. The 45 hours we accomplish within one intensive session.
Try harder, as hard as you can.
There's a significant change and a lot faster with the cage.
Having the cages allows you to have an extra 8 hands to isolate and hold the patient in a proper position so each muscle is activated and used appropriately.
Step 3 involves doing floor exercises and functional exercises, like going from sitting to standing. The TheraSuit retrains the central nervous system, provides external stabilization, aligns the body as close to normal as possible, corrects gait pattern, and provides deep proprioception to the joints. The 4th part of the program is gait training. This is done with or without the TheraSuit, depending on the specific needs of the patient. This part is essential for the patient being able to learn to walk. Part 5 of the TheraSuit method is additional training with the help of the Universal Exercise Unit. It promotes functional skills, strength training, and stabilization. It also acts as a reward at the end of the session. Another key to the success of the TheraSuit method is the Koscielny's dedication to research.
Knowing Richard and Isabella for the last 5 or 6 years and knowing what they've went through with their daughter's recovery, they've put their heart and soul into this methodology. I have never been so impressed with a couple that not only have found something that works really well, but is extensive as far as the research that they've done.
They are the only people that I would trust because I don't see anyone doing this much research.
They're always looking for information to improve the clinic.
When Janet Miller's son Jacob arrived here, doctors told Janet walking was out of the question. He has since taken his first steps.
It was very emotional for us. It was something that we were told by doctors would never happen, that he would never walk.
An additional benefit and critical component for further development of the patient is the home program. Patients are able to continue treatments without having to spend additional money or travel hundreds or thousands of miles.
And it's been wonderful. I don't think Natalie would ever have come as far as she is without the program.
Dr. Elizabeth Dobina and her husband have been using the home program for the past year. Their daughter Natalie was 7 years old when she began the TheraSuit method.
Then we reached a point where even her therapist said she needs something more because it was just tiny, tiny, tiny steps.
With the help of the home program, Natalie's progress has been remarkable.
We've seen a lot of huge gains, not only in her physical, but also in her speech development also. She sits just like a normal kid would sit, totally upright, which she couldn't do prior to that. She's walking with that walker so much more than she ever would have with conventional therapy.
And when questions arise, the staff is available by phone or email.
They videotape Natalie and they give us pictures inside the folder. So they show exactly how this stretch is supposed to be done. It's very easy to follow.
The results of the TheraSuit method are impressive, and new studies continue to confirm the effectiveness of the therapy. It's the results that make it all worthwhile for Richard and Isabella.
It's this incredible fulfillment. You have this incredible satisfaction that you are changing somebody's life, and that brings so much joy to everybody.
Work becomes more like a fun. You feel you accomplish a lot, and you just want to do even more. It's not even a job. It's just you say, who can offer me something like this?
To obtain more information about the TheraSuit Center and the TheraSuit method, or to schedule a consultation, please call or visit us online at www.suittherapy.com to learn more about the new standard in treatment for cerebral palsy.
The children with disabilities, they need fighters for them. And that's how I look at Isabella and Richard. This is something that they're doing from their hearts and their souls, and it shows.